Good day and welcome to the Bipartisan Policy Center's post-election healthcare event. I'm Marilyn Serafini and I'm director of BPC's Health Project. Healthcare has been on a bit of a wild ride during this campaign season. We started with healthcare as the number one issue in the campaign, with Democratic presidential candidates battling it out over the next approach to health reform. We heard a lot about Medicare for All, single payer system, building on the ACA, President-elect Biden's call for a public option. Republicans, meanwhile, continue to call for a repeal and replace of the ACA. But with COVID-19, everything changed. The public still cared about healthcare, but it was the virus they most cared about, who they trusted more to handle it. And with so many jobs lost, the economy became a major factor. Today, nearly 2 weeks after the election, there are still some important things we do not know about the political landscape, such as which party will control the Senate. Also, the Supreme Court will rule on an important case in the coming months that could invalidate all or part of the ACA. Regardless of these outcomes, we know that the country has work to do on healthcare. Healthcare costs remain high. Many people still do not have insurance coverage, regardless of the cost, and the pandemic is worsening. Based on exit polls, voting patterns were heavily influenced by the increasing rate of COVID-19 cases. We've invited an exceptional group of panelists to help us understand what this all means and what we can expect to see. What is the new political landscape, and what does it mean for healthcare and policy moving forward? First, we're going to hear from two respected political strategists who folks in Washington turn to regularly for their insight into the intersection of politics and healthcare. Celinda Lake worked on the first Clinton-Gore campaign and has done work for the DNC, the Democratic governors, the AFL-CIO, and many other organizations. She's also an expert in electing women candidates. David Winston has been a strategic advisor to Senate and House Republican leadership for the past 10 years, and he was the director of planning for former Speaker of the House, Newt Gingrich. After Celinda and David give us the lay of the land, two top healthcare experts are going to give us their reaction and their own take on what's coming. Chris Jennings is president of Jennings Policy Strategies, and he's also a BPC senior advisor. Chris served in the White House twice as senior policy advisor to both Presidents Clinton and Obama. He's been a senior health policy advisor to 10 presidential campaigns. In 2019 and 2020, he was an informal senior advisor to the Biden campaign and was appointed by Vice President Biden to serve on the Biden-Sanders Unity Task Force. However, today it's important to note that Chris is representing only himself and not the president-elect or his team. And our final panelist is Jim Capretta. He's a resident fellow and holds the Milton Friedman Chair at the American Enterprise Institute. Jim is also a senior advisor to the BPC. He spent more than 16 years in public service, including a stint as Associate Director of the Office of Management and Budget. We will be taking questions from the audience, and you can send us your questions in two ways, starting whenever you would like. If you're watching on YouTube or Facebook, you can submit questions via the live chat function. You can also tweet us your question using the hashtag BPCLive.
And I want to thank you all so much for being part of this. And I want to thank, I always love presenting with my Republican counterpart, who I have deep, deep respect for. So if we can turn to the next slide. So in terms of this election, voters trusted Biden over Trump in this last election on a number of issues. COVID and unifying America were two of the most major issues that that Biden was supported on, despite the whole controversy around defunding the police, et cetera. Maintaining law and order, Biden had an advantage as well, choosing the Supreme Court justice. And the one issue that really held Trump up in the election was the economy. His voters were economic voters. Biden's voters were COVID voters. And if you were a COVID voter, you voted overwhelmingly for Joe Biden. If you were an economy first voter, you voted overwhelmingly for Donald Trump. Here you see if you ask all voters who has an advantage, it's about even. And that's because people have two very different theories about why, what it takes to get the economy going. Democrats and independent women in particular tend to think that it takes getting COVID dealt with. Republicans and men tend to think more, let's just get the economy going. As you can see in the next slide, some similar data. If we turn to the next slide, you can see here what were the most important issues. And you can see that, again, measured a different way. Donald Trump won overwhelmingly the economy voters, and Biden won the coronavirus and the racial inequality voters, who tended to be Democrats to begin with. Here on crime and safety, and notice the difference between law and order and crime and safety. If you ask crime and safety, Donald Trump had a much bigger advantage. And this is a potpourri of issues in the crime and law and order and defund the police arena that take a lot of definition and really depend on the wording that you choose. Healthcare policy, which had been the election, or had been the issue that really moved the election to the Democrats in 2018. Democrats still had a very large advantage, but that advantage meant less because only 11% of the people picked healthcare as their number one issue. If we turn to the next slide, people believe overwhelmingly in the choice between containing coronavirus and rebuilding the economy. A majority of Americans, by 10 points, say containing coronavirus is first and then rebuilding the economy. And this is the central divide of the election. If you believe that coronavirus was number one, then you voted overwhelmingly for Joe Biden. If you believed we had to rebuild the economy was number one, then you voted overwhelmingly for Donald Trump. And the spike in coronavirus was helpful to Joe Biden, not that we would have wished for it, particularly among seniors and among suburban women voters. One of the challenges that Democrats face going forward is we still have to establish a more robust economic profile. If we look at the next steps that voters want the president-elect to take, people overwhelmingly support setting up a plan, including mass testing and contact tracing and new relief. And in fact, I think one of the challenges to both parties is voters overwhelmingly want another COVID relief package, and they're really upset that the parties cannot agree on this. And they haven't processed that the Democrats paid a past one already in the House. So this is a major, major challenge. And voters are going to really be looking for the parties to come together and pass something. And of course, as many of you know, and Chris will have a better insights than I do, this is something that's pretty bogged down right now. If that's kind of the issues that dominated the election, let's look at a little news about the coalitions. And I will say this, that we're having more trouble with the exit polls and more trouble with the post-election polls than we've ever had before. They really differ. But some things are clearly true. It is clearly true that Joe Biden did better with white women than he had done, than we did in 2016. It is clear that African-American women in particular, but African-Americans in general, were overwhelmingly supportive of the president-elect and the vice president-elect. And there was some gender gap in the African-American population, but still very, very strong. And a lot of differences in the Latino community, depending on what kind of Latino voter you're talking about. But no question that Latinas, who were very focused on schools and COVID, very, very supportive of the VP. If we look at the next slide, you can see that college-educated women were like the number one or a new base for the Joe Biden ticket. They had been very strong for Hillary Clinton and then fell away in the fall, particularly around the Comey letter. They were base and continue to be base for Joe Biden and Senator Harris, and they maintain that support throughout. In fact, it's the number one determinant of the suburban advantage. White college men, depending on the poll, we were even or just lost by 6, but still much better than we had done in the past. The white blue collar vote was the base for Donald Trump. One of the reasons that the results really closed at the end was that Donald Trump was very effective at mobilizing his voters, as we were very effective at mobilizing our own. But you'll notice there was a gender gap, and we picked up with white blue collar voters. That's still a challenge for the future, I think. The next slide shows you how these votes changed over time, and basically you can see the increasing margin for the Democrats across the board, even with the white blue collar vote. Next slide and last slide, role of government. With COVID, one of the things we've seen is really a dramatic increase in the desire for a role for government. Democrats are always desirous of a role for government, but you see here independents almost as supportive as Democrats. And you can see that that support has been for quite some time. Notice Republicans, interestingly, decreasing in their support for role of government for health insurance. And they have become a vocal minority, but it's interesting, they are a minority, and voters are very, very supportive of a role for government in the healthcare arena, although it depends a lot on how you define that role. It is also important when we think about all of the women voting groups that we saw in those slides that I presented beforehand. Women are the healthcare voters. 80% of the healthcare voters are women, and it is the one issue where they tell the men in their lives what to do, both in terms of voting and in terms of policy. So on that note, let me turn it over to David and for the rest of the story.
Okay, thank you, Selena. And as always, it's fun to do a presentation with you. We've done these a few times, and I have to say that I always learn something from yours that where I clearly missed something. So hopefully I can reciprocate. But anyway, let me start off with what I find to be sort of the bizarre outcome in terms of this election. While the current situation looks like that Biden won, his party lost. And so, how do you have a dynamic where that I haven't seen, where you have somebody ascend to the White House, yet the party struggled? One of the major differences for Biden as opposed to 2016 was that Biden won the rest of the country outside of California. Hillary Clinton had lost that group. To give you a contrast, Obama won outside of California, George W. won outside of California, Bill Clinton won outside of California. So Biden was able to do something that actually Hillary Clinton wasn't able to in 2016. Nonetheless, the race was a lot closer than expected, but at a 4% margin, which is where it is now, that really sort of gets beyond where you can have a popular vote victory yet lose the electoral college. The best situation where somebody won the electoral college but not the popular vote was right at 3%. At 4%, Biden was well beyond that margin. One of the other interesting developments, too, in contrast to 2016, was that according to exit polls, and one thing about the exit polls at this point that everybody needs to be aware of, there's one more round of waiting to come. So when you're looking at all these numbers, you may see some slight differences between now and the final version. But at this point, back in 2016, the party advantage to the Democrats was 3 points over Republicans. In this particular election, it was only 1 point. So this larger turnout seemed to produce a more equitable, not equitable is not the right word, more evenly balanced electorate between Republicans and Democrats. Going to Selena's point, there was a very complicated relationship between the economy and the virus. And basically, the situation was this. People were more focused on the economy, but you couldn't get to the economy until the virus was dealt with. And so people were trying to work through, okay, exactly at what point can we begin this transition? And we've obviously gone through some different scenarios in terms of government trying to work through that. But ultimately, at the end, the situation that emerged, as Selena showed in the data, was that before you can get to the economy, you have to have the virus under control to a degree where people have confidence to restart. nonetheless, that still produced a pretty close election outcome. However, looking at the Senate, that was clearly a more positive area for Republicans, particularly the victories of Tillis in North Carolina and Susan Collins in Maine. Susan Collins in Maine did something that was quite unusual in terms of this election, in terms of crossover vote. She won 19% of the Joe Biden vote. That was a pretty remarkable outcome. The other thing that we also learned, at least at the Senate level, is money isn't everything, as Lindsey Graham showed. Having been significantly outspent, Harrison had over $100 million, contrast to Lindsey Graham, maybe 15 to 20. The numbers aren't clear yet. But nonetheless, Lindsey Graham won by double digits, 10 points. The House is also the other location where things are quite different. The expectation was Republicans were going to lose anywhere between 10 to 16 seats. At this point, they're at 9. There are 4 outstanding races, so that's 209. There are 4 outstanding races that, in fact, Republicans lead in. So the range could be anywhere from 210 to 213. What that means is Nancy Pelosi is going to be dealing with a much smaller margin, and the challenge for her is how do you manage that environment, given the fact that 10 of those people, in fact, voted against her in terms of the speakership, and her margin is going to be quite close. And you can tell that the Democrats are struggling with the outcome of this election, give this sort of vigorous internal debate inside of the House conference. Um, One of the elements that I think that this election also showed was just the role of party brand. I think there were a lot of Democrats who ended up being unhappy with how the public ultimately ended up looking at the brand of the party, that there was potentially an overemphasis on certain individuals defining what that brand was, as opposed to a broader cross-section of Democrats that many felt better reflected who the Democratic Party was. Having said that, given all the positive news, as Linda laid out, Republicans still have challenges going forward. Clearly, the performance with women and independents, if Republicans are going to build an effective Republican majority, have to be improved. Going to specifically to healthcare, and I think healthcare is going to be a very different issue than it's been before. There were 3 big developments from dealing with COVID that will likely lead to a dramatically enhanced focus specifically on personalized care. The first thing was people were paying much more attention to the quality of their health. That sort of transition from being sick now is not being seen as necessarily being healthy. And what COVID did was basically sort of heighten this thing. You could not be sick, but still very vulnerable to this disease. So this whole sense of it's not about being sick, it's how do I sustain healthiness? And what that's going to get into is things like preventative care, wearables, data, a variety of different components. That's the first piece. The second piece was we saw that telehealth suddenly became a significant part of the healthcare delivery system. And there was one headline in a New York Times article dealing with healthcare in Great Britain where the title was 10 years of change in 1 week dealing with telehealth. And so it's this whole process of this transition, people getting used to that, wanting that as a delivery system. Third, this incredible focus that emerged for obvious reasons in terms of science, what science was doing, and in fact, this whole sense of where scientists could potentially deal with things. Again, given the current situation, the healthcare system was not going to be able to take care of people with COVID, as we've seen. You needed scientific advancement to ultimately deal with this. And so science is becoming central to the public in terms of healthcare. So research is changing the focus as you're seeing science move from cells as hardware to cells as software with things like genomics, immunology, CRISPR editing, et cetera. The challenge in terms of the ACA is sort of a debate about a healthcare solution geared toward the beginning of this century, as opposed to here we are in the 3rd decade of the century. Where does healthcare go toward? And one of the things that the ACA never really addressed was really the whole sense of supply. To some degree, ACA had sort of an underlying assumption that supply was basically inelastic, and that was one of the challenges in putting together that package. Um, but let me give you some potential positives as you look forward. First off, when it comes to what's happening with telehealth, one of the positive things we saw was a bipartisan group of senators in significant amounts sending a letter to CMS in terms of wanting to understand, in fact, how they were going to continue to help deal positively, allowing people access to telehealth functions. And then also you saw a very bipartisan effort around 21st century cures, that in fact you could see help move things forward and in a bipartisan way. The one thing, given where we are at this point, that everybody who's on this call should think about is the potential possibilities that exist as policymakers understand that we're now moving toward a sort of next generation of healthcare policy. And they're going to be looking for ideas in terms of how to move that forward and the opportunities that exist, therefore, to really begin to shape healthcare of the future as people really want to focus on how do we really get to a modernized healthcare system. So with that, I'll turn it back over to Marilyn.
David. All right, let's get right down to business here. So I'm going to turn to Chris and Jim. And what does this political landscape mean for healthcare policy moving forward? Let's talk about the first year, the first days, the first month. What is it you think Congress and the new administration are going to want to do, and what are they going to be able to do given this landscape? And let's not forget the Supreme Court. Okay, Chris, you first.
Great. Well, good morning. I hope you all can hear me. It's a pleasure to be with you. What's different? Well, we have a new president, and I think he's largely president because of COVID. I remember President Trump saying COVID, 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 and for good or for bad, I think that will be the focal point of activities of President-elect Biden until he is inaugurated in substantial ways. And we'll see time and time again a lot of focus on what he's doing on PPE, everything from testing, therapeutics, and of course, vaccine distribution as being a very, very big focus of his early part of his administration. And even before then, of course, will be the selection of new leadership within the administration. And there'll be lots of focus on that as well and its implications. What COVID has done to us is, of course, impacted all of our lives substantially, both in a health and economic way. And I think the vice president and now president-elect well recognizes that today. In fact, he's speaking on the economic impact and what we need to be doing as we are also addressing the healthcare challenges that we face. That won't change for the next several months. I think that what you will see is a change in how government is administered for this crisis. There'll be certainly more of a federal coordinating role, although there will have to be substantial collaboration with state and local governments. There'll be much more of a reliance on science and facts. There'll be much more of an empowerment of agencies and leadership within those agencies and trust building. There'll be absolutely a commitment to resourcing all of those policies in significant ways. And I think he hopes to see something in the lame duck session. I'm sure you'll be asking a little bit about that, but also subsequent to it, it will be a very, very high priority. He will be, as he's working on this, will be developing a baseline as to what the real challenges are and what currently is in place. And of course, I can't be here today, Marilyn, without talking about the frustration that the incoming Biden camp has with the Trump administration and its lack of acknowledgement of the election and the integration of both the current administration and the incoming administration to seek information that's necessary not just for national security, but healthcare security as well. And at a time of the pandemic, I think it's safe to say most people throughout the medical community thinks it is quite outrageous that has not occurred. Now, having said that, we will be transitioning to a new government. There's no question about that. And it could be a divided government. We don't know. We're going to watch for Georgia. Democrats have not given up on those elections at all, feeling that we have very strong candidates, that the president isn't on the ballot. They will be resourced well. And they're very, very strong messaging, including, by the way, healthcare messaging around Medicaid expansion. Nonetheless, even if the Democrats control the majority, there will have to be collaboration with Republicans in the Senate. And Democrats who are number 50, if they are number 50, will want to do that as well as the vice president. And the vice president is very committed to doing everything he can to try to have a constructive, collaborative relationship with the Republican leadership, whether they're majority or they're minority. I think I'm going to end with this. I mean, of course, early on in the administration, there'll be a focus on early administrative actions, overreaches, and unconstructive policy interventions that for the Democrats feel that Donald Trump has taken in terms of undermining the Affordable Care Act, and anything that we can do to strengthen it and strengthen outreach and enrollment will be something that will be very, very high priorities for the Affordable Care Act. And then there'll be real efforts to look at not only how we can do things administratively, but also legislatively as well, both through collaborations on subsidies and tax credits, hopefully, or some innovative and creative ways to get more dollars to people who need to have more subsidies, but also more ways to ensure affordability through cost containment through a whole host of different policy approaches. I'm going to stop with that and then turn it over to my friend and colleague, Jim. I'm sure after Marilyn, you maybe want to introduce him, and then we'll go from there and answer any more questions you may have.
Great, fantastic. Thanks so much, Chris. Yes, we're going to turn it over to Jim now. And I also wanted to mention that, we're talking about how COVID has really moved what we're doing from the policymaking standpoint, and also from in terms of what was important for voters. And the Bipartisan Policy Center has convened a group, a Future of Health task force, which Chris and Jim are both participating on, that will have some early recommendations very early in 2021 on public health and preparedness and handling of many issues when it comes to the pandemic. But even beyond that, the group will be looking at additional issues that are troublesome for the healthcare system. And this will be a relook. The group came out with a report last February, which you can access on our website, looking at issues in the healthcare system and how to move forward. So with that, I'll turn it over to Jim.
Good. Thank you, Marilyn. Thank you to the Bipartisan Policy Center for organizing this event. I learned a lot already from both Celinda and David's presentations. And of course, I always learn from Chris. Chris and I get to talk frequently about these kinds of topics. And so it's great to be on a panel with him and the others too. So in terms of where we're going with all this, the big picture, I think, is that we have somewhat of a split decision election, in the sense that obviously the big switch at the presidential level, we're going to have a Democratic president, Vice President Biden winning. He's president-elect now. I totally agree with Chris that it's completely irresponsible for the Trump administration and many elected Republicans to carry on the farce that the election's not over yet. It's irresponsible and needs to be put to an end very, very soon. So I hope that happens. But regardless, he's going to be the president come January. So I think we can have two periods of time that we should be thinking about. The first is, okay, once he's president, what's that going to look like in terms of the policy interaction with the Congress? Obviously, a lot depends on Georgia. But I think even without Georgia being decided, we can come to the conclusion that the parties are going to have to cooperate more if they're going to pass legislation. I mean, the margins are going to be quite narrow in the House and obviously very, very tight in the Senate. And so on any given controversial policy initiative, it's going to be very difficult to pass it with just Democratic votes. So for big things that the vice president campaigned on, and he's still hoping to pass, I think, when he takes office, things like the public option, things like having HHS negotiate drug prices, possibly also big subsidy expansions in the Affordable Care Act. I think I would put those three as sort of the biggest ticket items he'd like to try to get done. He made very clear he'd like to try to get done. Each of them carries with it controversy. And to get them passed, he probably would have to work with Republicans, and it's not at all clear you're going to get a lot of Republican cooperation on any one of those three. The third one may be the most likely in terms of perhaps shoring up the Affordable Care Act subsidy structure. But I'd say there, it's going to have to be a dance with the parties. Maybe if Republicans give on some of those items, they'd have to get an awful lot in return on some other items. And it's not at all clear the Democratic Party would be interested in doing that either. So, where all that goes, I think, is more than likely headed towards some frustrating stalemate on some of those bigger picture items. Having said that, a new administration can do an awful lot of things through administrative action, and I expect the incoming Biden administration to be very, very active administratively. They can do an awful lot through CMS, through HHS, to undo the Trump administration's efforts around the Affordable Care Act, things like short-term duration plans, perhaps association health plans, funding the outreach system, maybe trying to come to some resolution on cost-sharing subsidies that has a sort of equilibrium that looks sustainable. I think all of those things an incoming Biden administration will try to do, and maybe with some success. Now, in terms of the two periods I wanted to talk about, the more immediate one is the one right now, right? So a lot of our conversation has been about the pandemic, as it should be, because it obviously is a very major crisis for the country. And I think the president-elect is rightfully focused on it because it's likely to be an intense period when he comes into office. However, we're in this terrible situation where the outgoing administration is still in charge, and these next 2 months are absolutely critical. And so one thing to kind of keep in mind is that things that are decided now, particularly even in the Congress, relative to the pandemic, if they do a relief package now, if they fund more testing and tracing now, it can have an impact in January and February and March. If you wait till a Vice President Biden is made president, by the time you enact something, it's probably March 1 or something, right? And so, everything is just delayed. And by then, the course of the pandemic may have run its, this big wave we're in may have already run its course. So we really need to, as a country, be thinking responsibly about, we do have a government right now, and it ought to be acting now and not waiting for the president-elect to take office in 65 days. I think I'll stop there because I know there's a lot of things teed up, and turn it back over to Marilyn.
Thank you, everybody. Now that we've been through the round once, I'm hoping that others can start weighing in on some of these issues. But Jim, you bring up a point. The last piece that you talked about there was we have a lame duck session coming in, and given our political landscape and what we have moving, can anything happen in the lame duck session? And I'll open that to any of you on healthcare.
Well, maybe I'll just pick up where I left off. Oh.
No, go ahead, Jim.
Go ahead.
I'm sorry. Yeah, I'll just do 1 minute, Chris. I want to hear what you have to say about it for sure. So give me 1 minute on this. I really think that a lot of responsibility now falls on Senator McConnell's shoulders. That the administration, in some degree, is kind of checked out, and he's sort of become the de facto Republican policymaker on this. And honestly, I think he really has a responsibility to see and recognize that waiting 65 or 80 days or however long to do another bill is too late, that they have to do it now to have the impact it needs to have. And he should really reach out and kind of cut a deal with the House Speaker on this. It's splittable differences at this point. I think he does have leverage with the House Speaker. She wanted a $2.2 trillion bill. She's not going to get a $2.2 trillion bill. After the election results, she's just not going to get a bill that big. But even a $1 trillion bill with the right pieces in it could make a huge difference for 6 months. And they ought to be really focused on getting that done, because waiting to do another bigger bill, I think the House Speaker would make a big mistake assuming, hey, if I wait till March 1, I'll get a better, bigger bill. It'll be too late. And a lot of people will get hurt in the process. So I really hope they do a bill now. And I think Senator McConnell has the power to do it if he wants to.
Yeah, I think that for the country, and again, I'm just speaking for myself here, but absolutely, it would be in the interest of the nation for Republicans and Democrats to come together on a package. And of course, if there is one, it would have to be a compromise package. There's no question about that. But it's sort of unclear that the current administration has signaled actually proactive negative, and post this election. I think Republicans are really listening to Donald Trump, probably more so than I would have them do at this moment in time. But he picked up a lot of votes, and people are hesitant in crossing him. Senator McConnell really is the person who has to make this judgment. And of course, it's true, Speaker Pelosi will have to engage constructively, recognizing that she would not be able to get everything that she would otherwise want. I can tell you they both, I believe it's frustrating probably for both Jim and I, because we see a pathway here. And usually in these circumstances, I guess I would just tell Jim, I think it takes a little bit more than two to tango here, because the administration is going to have to give a little bit more of a lean in, I believe, to bring Republicans on board for an agreement in the Senate. But we'll see. And I hope for the good of the country, there's a movement forward, because if you think of the timing, as Jim suggests, the president-elect does not become president until late January, and then he would have to go through a whole process and a new membership with less members in the House, and unclear what's happening in the Senate. So certainty versus uncertainty suggests it would be good for the country if we lock in what we can do, and then we see what's left to do next year.
Celinda or David, anything to add here?
Yeah, if I may, I think one of the challenges that exists in terms of coming up with something right at this point is sort of understanding the dynamic of both bodies at this point as well. And that is, McConnell's hand has been somewhat strengthened, given the fact that the expectation was that there was a very good chance the Republicans could lose the Senate. Obviously, having Collins and Tillis win, and having the two seats outstanding being Georgia, there's a slight advantage clearly to Republicans in that dynamic. The other element is Joe Manchin has been very, very, very clear about not willing to support ending the filibuster. So that means if that's the case, then everything is a 60-vote dynamic, which creates an interesting situation, particularly as we wait for the 2 months. The other thing, too, is Pelosi's situation is not particularly clear. She's got to reevaluate her House conference. I mean, the internal fighting going on at this point potentially sets up a challenge of some sort in which Pelosi has got to figure out how she's going to sustain a majority coalition within her own conference, given all this dynamics. So understand you've got a result of this election that has sort of disrupted the normal process that was occurring prior to this, and both sides have to work through that. And I think it's pretty complicated at this point.
Yeah. So what does this all mean for? Oh, go ahead, Celinda.
I was just going to add one other thought, which is I think the secret sauce here may actually be talking to the voters. I think the voters, and particularly the silent majority that determined that Joe Biden was president, the suburban vote, the improvement, the mom vote, is a vote that really wants to get going and doesn't want to keep fighting. And I think what would be very, very interesting, I think if the Democrats could come together and if constituency groups could come together, and I think it would include Republican, Democrat, moderate ones that aren't particularly partisan either way. The voters are wildly, wildly in favor of a new COVID relief package. And I think rather than, we've been talking about inside out, I think it's a shame that we're not seeing more outside in. And right now, the groups on both sides are so tied up in contesting the election. But I feel this weekend that we kind of crossed a threshold. We got the Chamber of Commerce on board. We got the U.S. attorneys on board. You're starting to see election officials, local Republican election officials are highly incensed that their integrity is being challenged. And so they're crossing the Trump, that the politicians may be afraid of Trump. And I think David outlined that very well, and so did Chris. But the local elected officials are just enraged that their integrity and their efforts are being challenged when they take this role very, very seriously. And then obviously we have a record number of military and national security people already saying this is not the way to run a railroad. So I think it'd be very interesting if we could get ourselves into a position of an outside-in strategy, where that outside-in strategy is also, think about it, we're coming up against spikes in COVID, Thanksgiving, Christmas. These are times when people really want to come together, really want to help families, really worried about their family and others' families. And I think it could change the whole dynamic. I think too much of the emphasis right now, honestly, is inside out, and it should be more outside in.
Okay, thank you. So at what point do we get back to some of the issues from earlier in the campaign, which is the health reform and the problems that still remain with cost, access to care, coverage? We know that President-elect Biden had some proposals to have a public option. We also know that he had a proposal to lower the eligibility age for Medicare to 60. So let's talk a little bit about coverage and cost and some of these other issues. And let's not forget that the Supreme Court has a decision coming up which could really change the whole discussion. But when do we get back to some of these issues? Is it possible that a new administration will want to see some of this happen in the first 100 days? And Jim, you mentioned that some of what the new administration can do would be by executive order. So who'd like to kick it off?
Sounds like a question for Chris.
Okay, well, I'm going to. Okay, so I obviously the agenda remains the agenda for the president-elect. He's not going to alter it substantially, but of course he has to reflect the environment and the opportunities to and avenues he will have to pursue his priorities. I would say that he must start over and over and over again with stabilizing and moving the nation forward on COVID. I mean, nothing else matters until then. It's got to be both a health and an economic vision. I think health care is a part of the health vision. So that you do need to integrate health coverage with issues of public health, which suggests that there will be both administrative and legislative attempts to ensure that. For example, you can't really guarantee free coverage for vaccines and therapeutics and all testing if you don't have all the federal policies necessary to achieve that outcome with a very strong enforcement mechanism. And so there's no question that those will be very, very high priorities, as will greater reliances on Medicaid and support for Medicaid to support coverage in this very vulnerable time, as well as, frankly, outreach initiatives to ensure people understand their options and opportunities of coverage within the individual non-group marketplace and the exchanges. Now, the bigger visions, the bigger policies, I don't think he's planning on giving up on those, but there will no doubt be greater challenges imposed than there otherwise would have been if the Senate is in the minority in terms of the Democratic Party. And I think you kind of wait and see before you make any type of prognostications and projections about what's impossible and what's not impossible. I think no matter what, however, there are enormous administrative flexibilities that are granted to each administration. I think later this week we're going to hear a little bit more about that on prescription drugs from the Trump administration, as I understand it. So I would look for a very proactive engagement on all those issues, primarily because behind all the COVID dynamics, we have to remember The frustration in healthcare continues to be about cost and complexity and how difficult it is to navigate through the healthcare system, which surprise medical billing issues absolutely conveys in significant ways, and there's bipartisan interest in that, as well as greater needs to guarantee much better affordability, whether it's through some in terms of subsidies or whether it's in combination with significant more thoughtful cost containment. And of course, the Bipartisan Policy Center is interested very much in finding creative ways to do a much better job on purchasing and getting a much better return on investment for our multi-trillion-dollar investment in healthcare.
Talk a little bit about Medicare and how Medicare could play out early in this new administration and the new Congress because of the re-estimates regarding the hospital insurance trust fund exhaustion dates.
Right. That was directed at me, I assume.
Yes.
So
yes,
yeah, right. I think that those are going to be big questions. The HI trust fund, according to CBO, looks like it might be depleted of reserves by 2024 under current projections. That could get moved, frankly, up even another year or so if things go even worse economically over the next 2 years. So it's a very dicey situation in terms of reserves in the HI trust fund. That has often been a precipitating, trigger for administrations and Congress to take action on Medicare and trying to address some of the problems that exist in the program. I think the Biden administration will take it very seriously and try to get out in front of it. I mean, there is a tendency with the trust fund to try to take the easiest way out, right? Find the least controversial items that you can kind of put money into the trust fund that doesn't disrupt any voter. I'm hoping that doesn't happen because I think the program does need some updating and some real reforms. But I do think it could be a precipitating device for action in 2021. But let me just say a couple things about some items that might be bipartisan that could allow a Biden administration to work with a potentially more Republican Congress, even if it totally isn't in the majority. One thing is to look ahead is that the Trump administration did some things on price transparency. And it's not necessarily true that cuts across partisan, it's a partisan issue. There could be a lot of, I think, Democratic support, consumer group support for being more transparent about pricing and having that pricing be useful to people, which takes some work, okay? So you can't just sort of dump a bunch of information. You have to kind of present it in a structured way where actual real consumers can use it to make meaningful decisions. So that's something they might be able to work on together. I think also expanding insurance coverage, making people automatic enrollment into insurance so that it becomes more automatic and default. And then to your point, Marilyn, about Medicare, I think the value-driven agenda, right? The Affordable Care Act pushed value-based payments in a big way. The Obama-Biden administration pushed it. And then the Trump administration thought about not doing it, but then they embraced it. And because I think they probably realized there really is no alternative to it to some degree. And so now the question is, maybe you'll have a little more split political control in Washington. Can the two parties take what's there, which is some progress, but a lot of mishmash too, and make something coherent out of it and make it really systemic and a driving force in cutting costs in Medicare going forward? I think that's something to keep an eye on because I do think they could work together to make it even better in the future.
How urgent is this question right now with Medicare? And, Chris, David, Celinda, I'm wondering whether you agree with Jim on this and how quickly we could see some attention moving to Medicare from the solvency perspective. But please also feel free to talk about eligibility. That was one of Biden's proposals.
Well, just very briefly, and I'll turn it over to Celinda and David too. We don't want to monopolize this. Just to say that I think some of the things that Jim just mentioned are absolutely candidates for nonpartisan, bipartisan. They aren't political. They tend to be more provider purchaser debates as opposed to political debates. So certainly the auto enrollment is a part of the Biden initiatives. He thinks that there's really thoughtful ways to expand coverage in Medicaid, and some people who are getting close to free coverage in the exchanges. On Medicare, Marilyn, my view is that Medicare will always be a priority for both sides to ensure that there's solvency. Exact what the initiatives will be, I think part of this will be the timing of the trustees report, which I think will be, usually it's the end of the first quarter, second quarter, right, Jim? I think of
Yes.
of each year. And if we're still in the middle of COVID, it will get some attention, but it will probably be more focused around the easier interventions, which I think are more related to revenue financing alternatives as opposed to deep cuts in the Medicare program, particularly when hospitals and others are struggling with, they'll make a very strong argument, I think, that they're being burdened substantially by COVID until they're not. So I see it being discussed and debated, but I also think maybe the easier revenue solutions are probably the first down payment on strengthening the trust fund, and it definitely will happen.
So go ahead, Celinda.
Yes, but I do know about the public opinion, which is probably just rife with inaccuracies, but that's what makes me a good pollster, because I think like the voters do. So Chris can correct me, but there are two things that really stand out in the public opinion. One is that people are wildly in favor of lowering the age of eligibility. So they're actually for moving in the opposite direction, therefore expansion. And everyone's talked about the almost universal support for lowering it to 60, but actually there's quite high support for lowering it to 50. And people also think that older people will have if you've lost your job and you're older in this economy, you're going to have a lot harder time coming back. The second thing I would say is that one thing that's disconnected that we haven't talked about, but is very connected in voters' minds, and was an argument that we made in the campaign, which speaks to Chris's point about revenue. I think that you are going to see some changes in the Trump tax cuts for the wealthiest 1% and big business. And that was very popular in the polling throughout the campaign. The president-elect very committed to it. But in addition, what isn't talked about as much is the number one rationale for that was actually because the Trump tax cuts jeopardize or threaten Medicare. That was actually the single strongest argument against the Trump tax cuts. So you may see some connections there that we're not thinking about right now, because it's more about salient politics than salient policy. But it's just worth reminding ourselves what that data said.
I'm going to come at this from a slightly different direction, and instead of looking at it from rural areas, one of the challenges that's existed in rural areas hasn't been, can I afford it? It's, does it exist? And I think one of the things, and you saw an article today in the New York Times talking about the amount of medical professionals leaving the profession. And here, what happens, look, supply and demand works. If you put 30 million people into a system and you don't increase supply, what happens to price? Of course it goes up. And part of the challenge that we need to understand here is that, we're talking about all these accounting systems, but ultimately at some point in time, we have to increase the amount of supply of healthcare if we're going to address this. And that's why one of the things I was looking at, Fred Upton has come up with Cures 2.0 I'm blanking on the congresswoman from Colorado, the Democrat. That to me is an example of where you can actually expand the supply. That's something that Vice President Biden has been clearly supportive of. But if we don't start thinking about the supply side of what's available and how do we transition telehealth, how do we deal with wearables, how do we deal with immunology, all these new components, we're going to just run into increasing costs because there just isn't any more. I mean, when you have that level of demand, price has to go up. And ultimately, it sort of feels like what we're arguing about is what new electric typewriter should we purchase, as opposed to what we need to do is go to word processing and computers. And we've got to make that jump in terms of healthcare if we're really going to solve the problem for the country.
Okay, thank you. We actually have a great question from Catherine on YouTube. She wants to know what leverage or strategies the Biden administration has that it can use to obtain collaboration with red states on COVID and other health policy issues. And I'll add to that question because we really haven't talked about what trends we have seen. We haven't talked about this in detail in the states and what that means for health policy. And working together. So I'd like to turn it back over to Celinda and David to talk a little bit about what we've seen in the states from the election.
Well, I hope Chris will jump in as well, but there are 3 leverage points that I can think of. One is, first of all, that it's ironic because the structure of the government right now makes consensus harder, as I think several speakers spoke to. But the winning coalition that Joe Biden got and Kamala Harris got was actually a stronger governing coalition, maybe even than it was a political coalition, because of the way that he increased votes across the way that he brought new states in. I think he has the ability to go to Republican senators, and they know he increased the vote among rural women. He increased the vote among white non-college women. He really increased the vote among seniors who will dominate the election in 2022. So this is his coalition, ironically, is probably a better governing coalition than it was even a political coalition. The second thing I think we need to remember, and I think Chris can speak to this better than I can, I know David will have some comments. We have all the governor's races coming up in 2022. And so the arena here is going to be twofold. Marilyn, your question is right. A lot of people, and particularly since a lot of Democrats lost, a lot of people are going to be running for re-election as Democratic governors because we did uniquely well in 2018 and running to take governorships. And then the third thing I've seen, and others are more expert on this, David more expert on this than I am, but it seems as COVID is spiking, I think some of the Republican governors have kind of softened their positions on COVID. I mean, when you've got people having to be medevaced out of South Texas, this isn't a partisan issue anymore. They haven't got any more hospital beds. That speaks to Democrats, Republicans, Independents, and everybody. And we're only, others on this phone, much more expert than I am, we're only seeing the beginning. So I actually think that if we can get into a less polarized arena, you're going to see more ability to work with Republican and Democratic governors because it's just really a mess out there. And people are scared and they want action, and they don't care whether it's a Martian or a Republican or a Democrat who's taking that action.
I agree with Celinda's view in terms of how the electorate looks at it, but I am going to tell you that my sense, well, I mean, starting off at one level, again, the expectation here was the Democrats were going to do quite well. So ultimately, even though he's got this majority in it, and he's just barely over 50%, although nonetheless over 50%, the sense was that things slipped toward the end. And if you take a look at the late deciders, they broke by 12 points for Trump, which is how things sort of began to pull closer. But obviously, I mean, you still have a 4-point margin, and that's significant. Having said that, again, the state legislatures, you saw Republicans expand the number of state legislatures. And one of the challenges that exists in terms of the broad political discourse here is that, and this is an interesting statement given the nature of this group, and that is there is not effective cooperation across the two parties. And that's something that's going to have to be learned and developed, and it's not there. In fact, there's a sense of there are very different policy directions that a lot of people think are just purely politically driven. And so it's a behavior in the political discourse and interaction that's going to have to develop over time. And we'll see how that goes. Right now, I think it's a very complicated and difficult situation to address.
This is Jim. I just want to say one thing about this, which is that I very much agree with what Celinda said, that the country isn't really ready for how bad this is going to be for the next 60 days. I mean, all the public health people are saying it, and they're trying to reiterate it, and a lot of messaging, but it's going to be really, really bad unless some corrective actions are taken, including in red states. And so I think for Republicans who look ahead and can understand what's going on here, Senator McConnell, chief among them, if they don't want to be responsible for allowing a crisis to become literally a catastrophe, they have to do something. They can't just sort of say, well, we're reopening the economy and things. It's not going to be like that. It's going to be much worse. There are going to be overwhelmed systems and a lot of dysfunction. And so I think it's one of those moments where they don't have the choice and luxury of saying, well, the politics line up this way, and my voters, they're not really sure this is a problem. They know it's a problem, and they're going to have to act on it, despite the fact that it may be politically challenging for them.
Mm-hmm. So, Andrew, on Twitter, yes?
Marilyn, I'm just sorry. I just want to say one thing about this, which is that the governors and their local counterparts are going to get this much more quickly than the senators, maybe. But it's on them now. They know this. They will be pressuring the Congress to act. Now, maybe they won't react, but the systems are about to be completely overflowed. And we're talking about not just the usual conversations of backup, but, complete staff exhaustion and real staff shortage of taking care of patients that are very much needed. This could be a real problem. So my view is this moment now doesn't look great, frankly, with Republicans and Democrats coming together with a package. But I think it will likely change. And people are going to have to triage about what they really, really want here and what they need to prioritize. And we'll see whether it ends up being enacted into law or not. The last thing I just want to say is, in our last time we went through this crisis, we saw an executive branch that sort of shifted the responsibilities to the states and said it's not the federal role. And then we had a lot of governors competing with one another on limited supply and stuff like that. That would not happen, I think, under a Biden administration. There has to be acceptance of the federal role, and there also has to be support of the state role. And I think now, maybe too late, I don't know, by the time he is inaugurated, but it would be a very, very different vision and a very, very different experience.
So, Chris, how do you think the incoming Biden administration will work with the states and the governors? How do you think that they will? What do you think that they are going to do to come together? It sounds like you think that they'll be more successful.
The first question that Joe Biden is going to ask is not whether you are Republican or Democrat, or whether you're for me or against it, or whether you're being nice to me or not. That is not going to be the first question that Joe Biden asks. It will be, how can I help? I have limited resources. Let's work together about prioritizing, and let's prioritize those people most in need wherever they are. And, I'm sorry I feel so strongly about this, but it's really outrageous that we even had a discussion early in the year where this was a question.
So we have several questions coming in about getting supply to rural areas. We have one question from Shirley on YouTube with respect to supply, and what role do we think CMS or frankly anybody in the administration should play in making sure that supply exists and that it's adequate for rural and underserved areas?
Well, the first thing that CMS did, and this was the bipartisan letter that came from the senators, was that they re-looked at what telehealth regulations existed and sort of managed it in such a way to make it more accessible. I think and obviously that's a huge potential in terms of rural areas. So the question is, how can you build on that bipartisan effort to continue to expand out in terms of telehealth? And that's a good example of supply. How do you take resources from other locations and make them available more broadly and more effectively? And so I think building on efforts like that, again, you've got bipartisan support out of the Senate for that. They build on that to sort of grow that.
And I'd like to ask all of the panelists, telehealth has really just shot to the forefront of people's interests when it comes to healthcare. Yet a lot of these changes and flexibilities that you're talking about have been temporary. They will last as long as the public health emergency lasts. We at the BPC don't think you're going to put the genie back in this bottle. We've got telehealth as part of
Agreed.
healthcare delivery going forward generally, and rural areas. Of course, this has been a big concern for them from the very beginning. So, how do you see Congress and the administration working together to ensure telehealth moves forward and that we continue to, how do we make some of these changes permanent? Is that a possibility?
Well, I'll jump in. I'll jump in very quickly. I'd like to hear what the others say, but I think there is no opposition to it as best as I can see. I don't see hardly anybody saying we shouldn't do it. So I think it's just a question of if there's a vehicle, like another COVID relief bill would be a nice vehicle just to put a provision on saying, let's make telehealth a permanent part of the Medicare program and make it a readily accessible item. In terms of rural health generally, I think the issue there is really how to define the infrastructure that taxpayers are responsible for, and how to make that a reality. And it's a little bit like we have infrastructure around our country that's sort of like a public utility infrastructure, and there ought to be an element of that in healthcare that sort of has a minimum level of, you shouldn't be more than X miles away from being able to be taken care of in certain circumstances. And that could involve, transportation, it can involve a facility, it could involve any number of things. So I think we just have to get organized about how we finance that as taxpayers to try to make that a reality. And, it's right now it's a little bit haphazard. I think that's why it's a little bit challenging.
And Jim, if I can add to that, one of the components that you see in terms of that is this whole, I would suggest, a cross-party support for expanding broadband. I mean, that's not also just for healthcare; it's for education, a variety. And so you're identifying there are examples of where you don't have to pull party into it. You already have a level of support to move that forward. And so, how do we take advantage of those opportunities?
The other thing I would add is that you see record high support in rural areas. Supporting broadband is one of their number one policies. And you have a lot of Democrats like Tester and others who are saying, I come from a rural area. Our party needs to still improve on how we talk about rural voters. Biden stopped the hemorrhaging, improved our rural numbers a little bit, but it's nothing like we would hope it would be. So I think this is a great opening. And I think the biggest problem we have is people don't understand why it costs a lot of money once you have broadband. And people also think the market will drive this. People will demand telemedicine. They will want telemedicine. They like their experiences so far, much more than they anticipated they would like it.
Yeah.
And so you're going to see a real market driver for this as well. It's not just a public policy. People are going to want to have access to this. They're going to be talking to their providers about providing access to this.
Yep.
Okay, we're going to see if we...
Ellen, I don't want to be a skunk of the party, but I just want to say one thing about this, that there is excitement around both broadband and telemedicine and its potential for sure. There's not all complete buy-in for all the provider community on this yet, and also we've seen huge spikes in an increase at the beginning of the year, but then decreases later on. And there are payers who are very concerned about abuses of use and misuse and excessive use of this technology too. So I'm not saying in any way, shape, or form that the overall momentum is great, but I don't want people to hear like it's frictionless, because I think there's definitely some outside questioning going on about kind of the overselling of this as the cure-all to all of our problems.
Okay, thank you, Chris. I would absolutely agree. I'm going to try to turn it back over to Kathy Hempstead, and let's see if we can make it work this time. We'll give it one more try. Okay, Kathy, let's give it a go.
Very much. Sorry for all the problems I've been having. I think this has been a great conversation, and I guess I just had a few things that really struck me as sort of good takeaways that I wanted to share. One, I think, is about the relief bill. I thought the potential of relief bill. I thought the outside-in framing was really terrific, and it seems like there's a lot of support, a lot of timing, and there's a lot of argument for it making sense for people to come to some kind of agreement. And I was just struck by how much COVID dominated all of the conversations that we've been having, even when we try to get to other health policy issues. And I don't think it's a case that we're going to sort of get done with COVID and then go back to the conversations that we were having. I think COVID is, revealing a lot of weaknesses, maybe a few strengths, but a lot of problems with delivery, finance, and equity in our system. And it's also changing our system. I think we've been talking about is close as a COVID. And then, the final thing, I think Jim and Chris both brought this up, and it came up in the context of the future of healthcare, is that there has to be a recognition, I think, to move forward on coverage, that you need to both expand eligibility and at the same time contain costs. And there were some really strong bipartisan recommendations in that future of healthcare document. And I haven't seen that in a bipartisan way. So I'm really looking forward to seeing whether we can make some progress along those lines. And with that, I'll turn it back to Marilyn, and thanks everybody. This has been terrific.
Okay, thank you to all of our panelists for being here. We know that we know some things about the political landscape. We know that we are still waiting to understand other things, and we're all going to look forward to seeing what kind of attention there is and where the attention focuses in 2021. So thank you again from the Bipartisan Policy Center, and thank you to the Robert Wood Johnson Foundation for their support of this event.